Welcome to Working for Women, the Independent Women's Forum podcast, where we are changing the conversation about women and public policy for the better.
Welcome. I'm Carrie Lucas, president of IWF, and I'm here with IWF's Julie Gunlock. Julie, thanks so much for being with me.
I'm glad to be on. Thanks.
Great. Well, Julie, we've heard some really disturbing news about the spread of measles in parts of the Pacific Northwest. And this seems like a real shock to those of us who know about the availability of vaccines that prevent these diseases like this. Tell us a little bit about what's going on.
Yeah, it is really scary what's happening in the Pacific Northwest. Washington State has actually declared a public emergency because there has been an outbreak of measles, an out-of-control outbreak of measles in Clark County, Washington. 53 people, mostly children, are infected. One child is hospitalized. He is in serious condition. And now another 4 cases have been confirmed in Oregon, just over the border in Oregon. So it is spreading. And again, we've had some cases in King County. Most of this is in Clark County, Washington State. But again, we are starting to see it bleed into Oregon. And now King County, which includes Seattle, has also had a case. So the public health officials there in the state of Washington and Oregon are sort of desperately trying to get this under control, to contain the infection as it is, but also to get more people vaccinated. What's so horrifying is that you have massive amount of people in the Northeast, rather the Northwest, who are not vaccinated. This is, Oregon, there's a reason that Oregon and Washington State, there's a reason that show Portlandia, which sort of makes fun of hippies and sort of liberals. It's a great show, but there is a reason why that show takes place there. There are large pockets of people who don't believe in vaccinations. They think they're suspect of them. They think that they're somehow harmful. We know that, there's been, since the 90s, there's been this myth out there that the MMR, which is the measles vaccine, measles, mumps, rubella, causes or is connected to autism. This was due to a fraudulent study that was done in the 90s and published actually in The Lancet. The Lancet later retracted it. The doctor responsible for it was charged with actually abusing some of the children that were in the study. He lost his medical license. But that has reverberated. That has been something that really created the modern anti-vax movement. And so we have a number of children not vaccinated in that area. 1 in 4 kindergarten students during this last school year did not get all of their immunizations in Washington State. And there are 3 schools in the county that are now experiencing the outbreak where 40% of kindergartners did not receive the recommended shots before starting school. So what you have here is you have an outbreak. And for instance, these things spread because, an unvaccinated child might, for instance, there was a case where an unvaccinated child visited Israel with their family, got measles, got on a plane, came home, and infected all the people around him. Measles is incredibly contagious, and it can basically live in the air for quite a while. So it can actually, after someone's sort of passed through, you can still get infected. So now we have this terrible outbreak, and it's really sort of brought awareness to the people there who were sort of comfortably anti-vax. It's now made them sort of wake up, and so now there's been an uptick in vaccinations. That's great news. But it is really sad that it took an outbreak like this, that is spreading, by the way, and it continues to spread, to remind people of the importance of vaccinations and to sort of debunk some of these myths out there. Paul Offit, who's a doctor, and he's an immunologist. I'm sorry if I'm getting that pronunciation wrong. But he talked about how we haven't, the United States eradicated measles. And so it was gone, and it's come back. But he said the reason that it's come back is we also eradicated the memory of the disease. People don't remember what it was like to see their friends and family suffer with these diseases. We don't have any concept of what it was like, for instance, to be in an iron lung if you got polio. And so this is now making measles, these outbreaks and other diseases are making these diseases reality again. It's reminding people of how brutal they are, how they can kill, blind, maim. And it's sad that it's taken that to get people more interested in getting vaccinated. But at least we're starting to see an uptick in vaccinations in the Pacific Northwest.
Yeah, Julie, it's interesting because I feel like it's the thing that kind of makes me really upset when I hear this conversation and hear about situations like this, is that we all know that there's some people who actually can't get vaccinations. If your child has certain times where I believe childhood leukemias or certain kind of immune deficiencies, that means like this is not an option for you, and you are literally depending on the herd, the herd
immunity. Yep.
Yeah, you want everybody who's in your kid's class to not be a carrier because your kid is susceptible. So it's really I feel like it's when you're making a decision like that, it's you're putting not just your child at risk, but others who have no choice.
There's a social contract. We all share responsibility when it comes to these infectious diseases. We share responsibility for our neighbors, not just ourselves. And we have a responsibility in a civil society to protect ourselves from these diseases so that we do not spread them on to other people. This is, even staunch libertarians, who say, look, you should have control over your body and you should control everything. Many of them say, no, when it comes to infectious diseases where you can innocently, not on purpose, but kill someone, it is part of the social contract to protect yourself so that essentially you can protect your neighbor. It's interesting that Washington State now, liberal Washington State, is now talking about forcing parents to immunize their children. Now, as pro-vaccination as I am against this because I think that gets into some creepy stuff. I don't like the idea of the government forcing you to do anything, even though, as I just said, these people are in violation of the social contract and they could actually kill someone. But I think there's another way to do this. Look, every state in this country, except 3 states, California, Mississippi, and West Virginia, every other state allows a parent to reject vaccinations for non-medical reasons, okay, such as religious or personal beliefs. Now, the reason that this is problematic, and I've actually written about religious exemptions, which there is no religion in the United States, no recognized formal religion in the United States. I mean, there might be some random cult, but there's no formal recognized religion that advises that is officially anti-vaccine. Now, there is some question about Christian Scientists who do reject sort of medical intervention. But it's interesting. The head of the Christian Science Church has actually spoken about this and has said, no, we do not advise people not to get vaccines. We tell them, go ahead and get your vaccine, but then pray that nothing goes wrong. So they believe in prayer to heal. But when it comes to infectious diseases, they seem to understand that they have a responsibility to advise their congregation to protect their children so that they can protect other people. They see a moral reason there. And so there's really no religious exemptions that should be allowed. And then on personal beliefs, this is the big catch-all, okay, when you have people who sort of just decide they're anti-vax. They're not particularly religious, but they just are like spooked, right? Because they Googled vaccines and saw a million theories out there, and Jenny McCarthy and Oprah and a bunch of people saying they're bad. That's where the personal belief thing comes in. Now, look, you get rid of religious and personal beliefs, and there's really no way that you can avoid participating in publicly funded things. So if you don't have if you're not vaccinated, you don't get to go to public school. I really think also doctors need to be harder on this and reject patients from their private practices if they don't get vaccinated. I think religious leaders need to get on the pulpit and say, vaccinate your kid. It is the moral thing to do. So I think there are ways to really to encourage people to vaccinate without forcing them. Again, the word force, any kind of government force makes me nervous. But I do think there needs to be harsher consequences for people who don't vaccinate. And again, things like just you are not allowed to participate in publicly funded services. And that includes, I think, welfare services. So I think there are ways to persuade people without forcing them.
Yeah, that's interesting. And I think there could be an interesting conversation about the religious exemption issue, because if there are people who can show that they have, a true religious objection to this, and that this is part of their true demonstrated faith, I think that would be such a small community that's truly in that camp that I could imagine trying to carve something out for them But the casual, because I do think a lot of this is laziness. I think, or laziness and kind of buying into hype and thinking, who cares? I don't need to do it. And kind of believing that you're going to be safe and thinking kind of in a, like, I will only eat organic type of way, that I don't want to put anything foreign into my kid's body. And I do think that is really the kind of the hubris that we've been allowed to have as people who've lived in the modern world where we've never seen this before.
Well, you're right. You're right. The personal belief catch-all is the one we really have to worry about. I mean, I certainly do think that there may be, again, I don't think there's recognized sort of formal religions, but the Amish community, for instance, probably does not want to be vaccinated. So certainly there can be, and you're right. That's why herd immunity is so important, to not only catch, herd immunity is supposed to, when there is an actual religious reason, those people are supposed to be protected, but also those who are immunocompromised, like people fighting cancers. Newborns don't get their vaccines right away. You have to wait up to 6 months to get some vaccines. And then the very elderly, sometimes they also can't be vaccinated. So these are the people they were supposed to herd immunity is supposed to protect these people, not the entire population of Clark County and their crazy anti-vax parents who don't immunize their children. So anyway, this outbreak hopefully will bring more awareness, more education, and hopefully we'll see some changes.
Yeah, well, that's, that would be a silver lining to a very dark cloud. So, Julie, thank you so much for doing this with me today. Everybody out there, go make sure your kids are vaccinated. Get your own vaccinations if you haven't had them. And if you like this podcast, please give us a thumbs up and come visit us at IWF.org, where all issues are women's issues.
If you enjoyed listening to this podcast, please give it a thumbs up, share it on social media, or stop by IWF.org for similar content.